Good evening everyone, thank you for joining me today. My name is Tao Ting Lian and I'm here to talk about communication and counseling skill for nurses, especially focusing on the LEARN framework in patient care. This framework helps nurses effectively educate and empower their patients. So let's dive into it. After this presentation of you able to understand the role of communication in nursing, identify the components of the LEARN framework, and apply the LEARN framework to patient interactions. You're able to evaluate the impact of communication techniques on patient care. As nurses, our roles extend far beyond just administering medications or performing procedures. We are educators, counselors, and advocates for our patients. One of the critical elements of our role is to provide psychoeducation therapy, which helps empower patients by providing them with the knowledge and skills necessary to manage their health condition effectively. So to support this role, the LEARN framework offers a structured approach to communication and counseling. It allows us to guide our patients through understanding their health conditions, addressing their concern, and developing a plan that aligns with their personal goals and lifestyles. Throughout this presentation, we will discuss how each component of LEARN framework can be applied in practical settings to enhance patient care. The LEARN framework is a mnemonic that helps us remember the key elements of effective communication in nursing. It stands for listen, explain, acknowledge, recommend, negotiate. Each component plays a crucial role in our interactions with patients. By following this framework, we can ensure that we are providing comprehensive and compassionate care that meets the unique needs of each patient. Let's explore each of these components in more details. First, we have listening. Active listening is a cornerstone of effective communication in nursing. It involves more than just hearing the words a patient says. It is about understanding the underlying concerns, fears, and emotions. Active listening allows us to create a safe and trusting environment where patients feel heard and valued. For example, consider a patient named Mr. A who has been diagnosed with chronic kidney disease. During our initial interaction, Mr. A expressed his concerns about the impact of his condition on his independence and daily life, particularly his love to cooking. By actively listening, making eye contact, noting, and occasionally summarizing his statements, I was able to fully grasp his concerns and reassure him that his feelings were valid and important. Active listening not only helps us understand our patient better, but also help in building a therapeutic relationship, but encourage patients to share their concerns openly. The next step is explaining. Once we have listened to our patient and understood their concerns, the next step is to explain the medical information in a way that is easy for them to understand. This involves simplifying complex medical terms, using visual apps, and employing analog or metaphors that make the information relatable. For instance, with Mr. A, I explained the concept of chronic kidney disease using a metaphor comparing the kidneys to a coffee filter. For instance, with Mr. A, I explained the concept of chronic kidney disease using a metaphor comparing the kidneys to a coffee filter. I say, think of your kidneys as filters that clean your blood, similar to how a coffee filter separates the coffee from the grounds. When the filters are not working well, waste can build up, just like coffee grounds in your cart. I also use diagrams and images to visually illustrate the functioning and malfunctioning of kidneys. By using these techniques, we can enhance patient understanding and engagement, ensuring they are well informed about their health condition and the treatment option available. Moving to the acknowledging, this step involves recognizing and validating the patient's feelings and emotions. Acknowledging a patient's emotion is essential because it helps build trust and rapport. It shows the patient that their feelings are respected and taken seriously. For example, after explaining the dietary change that Mr. A needed to make due to his CKD, he expressed frustration and sadness about not being able to enjoy his favorite meals. Instead of dismissing his feelings, I acknowledge his emotions by saying I understand that this is a difficult adjustment and it's completely normal to feel this way. It's important to talk about these feelings and find ways to adjust while still enjoying your meals. Acknowledging a patient's emotions helps them feel supported and understood, which can significantly impact their willingness to follow the treatment plan and make necessary lifestyle change. Next is recommending. After listening, explaining, and acknowledging the patient's emotions, we move on to providing personally recommendation. These recommendations should be tailored to the patient's specific needs, lifestyle, and preference. For Mr. A, I recommend a diet plan that includes his favorite foods in moderation and introduce new recipes that will kidney friendly. I also suggest a light exercise routine that aligns with his daily activity and interests. The goal was ensure that the recommendation were practical, achievable, and aligned with Mr. A's lifestyle and personal preference. By providing personalized recommendations, we empower our patients to take an active role in their healthcare, increasing their confidence and motivation to adhere to their treatment plans. The final component of the Learn framework is negotiating. This step involves working with the patient to develop a care plan that is flexible and respect their values and preference. Negotiation is about finding a middle ground that balances medical recommendation with the patient's individual needs and goals. In Mr. A's case, we negotiate a care plan that includes regular check-in and condition monitoring. This plan was flexible enough to accommodate change in his condition and personal preference. We also discussed setting short-term and long-term goals to track his progress and make necessary adjustments along the way. Negotiating a care plan with the patient ensures that they are actively involved in their healthcare decisions, leading to better adherence and satisfaction of the treatment process. Using the LEARN framework has a significant impact on patient care. It enhances our communication skill by encouraging active listening and clear explanations, which improve patients' understanding and engagement. Building rapport through empathy and cultural sensitivity strengthens the nurse-patient relationship, fostering a supportive and trusting environment. Moreover, the framework promotes patient-centered care by involving patients in the decision-making process and creating personalized care plans. This approach not only empowers patients but also increases their satisfaction and adherence to treatment regimes, leading to better health outcomes. Overall, the LEARN framework is a valuable tool for nurses to deliver effective, compassionate, and patient-centered care. In conclusion, the LEARN framework is a powerful tool that guides us in our roles as educators, counselors, and advocates for our patients. By focusing on listening, explaining, acknowledging, recommending, and negotiating, we can provide more effective and compassionate care that meets the unique needs of each patient. By implementing this framework, we can improve patient satisfaction, health outcomes, and trust in the healthcare provider. I hope this presentation has provided you with valuable insights into how we can enhance our communication and counseling skills using the LEARN framework. Thank you for your attention.